What's up guys? Welcome to our vlog. If you are new to this channel, please click the subscribe button and the notification bell for more videos. Today, we are going to give you a discussion and explanation about genetics and prenatal development and also the developing brain of the baby.
This video is for educational purposes only. The characters and role like doctors and mother are all created to act the scenario and not our real identity and profession. All the things and word we're saying came from researches about a certain topic.
A pleasant day to everyone. It is the best time for you to learn about genetics and prenatal development. First, what it's like to be a pregnant.
What is happening to me? What is happening to me? These past few days, I notice that every time I wake up in the morning, I am not feeling well. I am experiencing dizziness, and when I smell something unpleasant, I puke. I am thinking of one thing, but I am not sure. I must check it.
The most common early signs and symptoms of pregnancy might include missed period, tender swollen breast, nausea with or without vomiting, increased urination, and fatigue. If you are experiencing and finally confirmed to be pregnant, congratulations.
It is not confirmed, but what am I gonna do? It's my first time and I'm really nervous. Maybe I should ask for my obliging friend regarding this matter.
Congratulations on your pregnancy. Grabe, parang kailan lang, no? Parang kailan lang tayo pa yung baby. But now, magkaka-baby na kayo. But anyway, alam mo na ba yung mga dapat gawin at hindi dapat gawin during pregnancy? Swerte mo dahil kaibigan mo ko. So, yan, let's start. During prenatal stage, genetics and environmental factors can affect the development of your child. The developing fetus is completely depending on your mother for life. So it is important for you to take extra good care of yourself. As your doctor, I advise you to take vitamins with folic acid, iron, and calcium. And eat foods that compose these vitamins, like fruits, vegetables, eggs, milks, tofu, and beets. But anyway, I'll just give you the list. So these vitamins can help you to have a healthy pregnancy. Folic acid can help reduce the risk of birth defects that affects the spinal cords of your baby. Iron reduces anemia, and calcium support the healthy formations of a baby's bones, heart, nerves, and muscles. So when the zygote attaches to the wall of the mother's uterus, the placenta is formed. The placenta provides nourishment and oxygen to the fetus. Most everything that the mother ingests, including food, liquid, and even medication, travels from the placenta to the fetus. So the common phase, eating for two. Anything that the mother is exposed to in the environment affects the fetus. So if the mother is exposed to something harmful, the child can show the lifelong effect. But anyway, you have to avoid eating junk foods, salty foods, acidic foods, and caffeinated beverages. So yun, bawas muna sa pag-inom ng kape or mas maganda kung itigil na talaga.
And as pregnant woman, you need to take care of yourself. You need to eat healthy foods and take some nutrients like iron, calcium, and folic acid for the baby to become healthy.
Additional information, we have these factors that could influence and affect the development of the baby. First is the teratogen. It is any environmental agent, biological, chemical, physical, that causes damage to the development of embryo or fetus. There are different types of teratogens like alcohol, cocaine, lead, mercury, arsenic, cleaning products, pesticides, cigarettes, and methamphetamine. So, drinking alcohol during pregnancy has been found to be the leading preventable cause of mental retardation. Also, fetal alcohol spectrum disorder. So, fetal alcohol spectrum disorder is a collection of birth defects associated with heavy consumptions of alcohol during pregnancy. FAST may have a small head size and abnormal facial features. Children may also have poor judgment, impulse control, and higher rate of ADHD. So cigarette smoking is also considered as teratogen. Some of the smoke, the developing baby experiences a reduction in blood oxygen levels, while taking heroin, methamphetamine cocaine might lead the baby to burn with heroin addiction. So the child might have seizure. And other factors that should be avoided is birth defects and maternal infection that includes rejection, viruses such as HIV, herpes, rubella, or also known as German measles. So phenylketonuria, Gorge syndromes, and also Zika virus. You also have to avoid maternal anxiety, stress, and depression.
The healthy women are like this. While the unhealthy women are like this. While we are in the topic, let me give you some video clips about genetics and prenatal development. Genetics and prenatal development. Did you know around 200 kinds of cells are needed to create our bodies? At the center of the cell is the nucleus. The nucleus holds 6 feet of deoxyribonucleic acid or DNA, tightly packed into 46 chromosomes, 23 from the father and another 23 from the mother. Do you know how humans form? Humans form in the process called prenatal development. Prenatal development of the baby from conception to birth takes about 40 weeks. In taking about gestation or the period of pregnancy, we usually divide those weeks into 3 parts or trimester. We call it the first trimester, the second trimester, and the third trimester.
Wow! That's a great information. I have learned a lot. Thank you for sharing. I must visit you soon.
The newborn baby, the evidence that very young infants are active learners is compelling. They are born able to find the nipple and suck, thanks to inborn reflexes. They like to look at human faces and hear human voices. They use facial expressions that adults can easily understand, even though they have never seen their own faces. Newborns are ready to learn and ready to engage in relationships.
the second part of our discussion, we are giving you a discussion and explanation about postnatal and prenatal development of the brain. The brain begins development within days of conception. Rapid cell division follows from a moment of conception. At 4 weeks, neural grooves appears, establishing two cerebral hemispheres. Thousands of neurons generated, creating forebrain, midbrain, and hindbrain.
A human infant is born with more than 100 billion neurons, twice a number he will have as an adult. Also, synaptic connections develop rapidly in the first 3 months of life. Hormones associated with stress and violence can change the structure of the brain, creating a brain that is attentive to danger but not to affection. Postnatal brain development. The first 3 months of life are sometimes referred as the fourth trimester of gestation. Human babies are born after 9 months in the womb, but they still have significant developmental tasks before them. Although the brain has been growing and becoming more complex, at birth it is only 25% of its adult weight. The lower parts of the brain, which are spinal cord and cortex, are well developed, but the higher levels of the brain are quite immature. Now, let's go on to the abilities of a newborn baby. They are able to find the nipple and suck thanks to inward reflexes. They like to look at human faces and hear human voices. They use facial expressions that adults can easily understand, even though they have never seen their own faces. We can say that newborns are ready to learn and engage in relationships. Now, let's discuss about premature birth. Not all babies remain in the womb for the full gestation of 40 weeks. Infants born before 37 weeks gestation are considered premature.
Premature birth creates many challenges for the developing newborn. A premature birth is a birth that takes place more than 3 weeks before the baby's estimated due date. In other words, a premature birth is one that occurs before the start of the 37th weeks of pregnancy. Premature babies, especially those born very early, often have medical problems. Typically, complications of prematurity vary, but the earlier your baby is born, the higher the risk of complications.
Causes of premature birth are not always known, but the common causes include external threats to maternal and fetal health. It includes mother's use of cigarettes, alcohol, drugs, poor nutrition, physical stress, and lack of prenatal health care. The first days and weeks after birth are a time of great adjustment for infant and the family, especially for the mother.
The baby is adjusting to life outside the womb, managing breathing, eating digestion, elimination, temperature regulation, and an array of sensory experiences. Infants and young children vary greatly in their sensitivity to feelings of comfort and discomfort, familiarity and strangeness, and emotional context in which sensory experiences occurs. Over the course of the first year, synaptic connections will begin to form an outstanding rate of peaking of 2 billion per second. Interactions with objects, including touch and language, as well as the child's own movement, stimulate synapses and connections. In the first decade of life, the child's brain forms trillions of connections or synapses. Axons connects to dendrites, and chemicals called neurotransmitter help send messages called impulses. Across the resulting synapses, each individual neurons may be connected to as many as 15,000 other neurons, forming a network of neuron pathways that is immensely complex. This elaborate networks is sometimes referred to as the brain's wiring or circuitry. As the neurons mature, more and more synapses are made. At birth, the number of synapses per neuron is 2,500, but the age of 2 or 3, it's about 15,000 synapses per neuron. The neural network expands exponentially. If they are not used repeatedly or often enough, they are eliminated. In this way, experience plays the crucial role in wiring a young child's brain. Brain development does not stop after early childhood, but it is the foundation upon which the brain continues developing. Early childhood is the time to build either a strong, connected, or unreliable foundation. These early years are very important in the development and that continues in the childhood, adolescence, and adulthood. The infant depends entirely on responsive adults to help him regulate or manage his reactions to hunger, fatigue, and other discomforts. Sense of hearing. During pregnancy, many mothers find that the baby keep on jump and respond to loud noises and make sounds and soothing musics. Hearing is fully developed in newborns. Babies with normal hearing should startle and respond to loud sounds. These babies are also pay quiet attention to the mother's or father's voice. The sense of smell. Studies have found that newborns have a strong sense of smell. Newborns prefer the smell of their own mother, especially their breast milk. The sense of taste. Babies prefer sweet taste over sour and bitter taste. Babies also show strong preference for human milk and breastfeeding. This is especially true if they are breastfed first before offered formula or a bottled milk. And last, the sense of touch. Babies are comforted by touch, or placing your hand in their bellies or cuddling close can make them feel more secure.